right, let's talk about what to expect in a school-age child. Find out who's accompanying the child, how they're related to them, and conduct your exam. Okay, the child is going to want to feel brave. You're going to expect this child to be more modest than your younger age group. The school-age child needs to sleep between 10 to 11 hours at night. Some of these children may be getting the iPads, and some of them may even be getting phones, but they need to be monitored, and the electronics need to be turned off at least 1 hour prior to the school-age child going to bed. These children are going to want to please adults. They're going to be wanting to engage in organized play, and they may think about being in groups like an academic group or even a sports group at school. It's important that caregivers realize that the child is definitely watching them as a role model. It's going to be important to exhibit healthy behaviors. These children, although they want to be brave, they still have fears around pain, death, and loss of control. When you think about injury prevention in this age group, you want to discuss helmet use, seatbelt use, water safety, and we're starting to get into the age where we need to talk about tobacco use, vaping, alcohol use, and drugs. The school-age child really cares what their peers think, and they're gonna want to do what they think that their peers are doing. So it's important to answer any questions they need to know about sexually transmitted infections, consent, boundaries, and privacy. The school-age child needs about 70 to 100 kilocalories per kg per day, and they're going to grow about 2 to 3 inches per year. They'll gain about 5 to 7 pounds each year. The child's growth needs to be documented at every visit. These data points can identify sudden shifts in the height or the weight, and may even be the first clue of an underlying issue. Height and weight trends over time are more important than a single measurement. So when you start collecting the subjective data for these kids, you want to make sure that you ask about risk-taking behaviors, like with that tobacco, alcohol, vape use. Do they know anybody that's using it? Try to have an open conversation about that. You want to talk about nutrition, elimination, sleep, and any parental concerns. And you also want to see if they had any visits to the urgent care or the emergency room between visits, and if they were started on any medications. The physical exam needs to be a complete set of vitals, a body mass index, a complete physical exam. Permanent teeth are on the way. The vision is approaching 20/20. And now we're going to start documenting the Tanner staging. Precocious puberty is less than 8 in females and less than 9 in males. This brings us to the end of the well child period for the school-age child, and I will see you in the next video.